Welcome to the ASDA District 1 Dental School Debate. It is with pride that Creston Oral-B is able to maintain this great tradition through our sponsorship. Along with you, we value this experience as a way to enhance your dental education and have a little fun and spirited competition along the way. I'm Dr. Cindy Stegeman, and I'm a Scientific Relation Manager for Crest Oral-B, and I cover all of your dental schools. I've met many of you already and hope to meet many more in the near future. I am thrilled to highlight our newest innovation, the Oral-B IO. Take a look.
Say hello to Oral-B IO. New Oral-B IO technology takes the oscillation rotations from Oral-B's iconic round brush head and combines them with the gentle energy of micro vibrations for an enjoyable experience and a sensational clean. Thousands of bristles gently micro vibrate and glide effortlessly around the surface of each tooth, while also brushing along the gum line for a powerful yet gentle clean. Experience the only wow clean with Oral-B IO technology. Only from Oral-B.
Thank you again for your time today, and I look forward to seeing you virtually at one of my upcoming events. Let the debate begin, and may this best school win.
Hey, I'm Chris Salerno. I'm a general dentist in New York and a member of the board of directors for EDIC. I'm so glad you guys are taking time from your schedules to participate in and watch these debates. It's so important. It really is to develop those critical thinking skills, whether you're a debater or whether you're just supporting your team here. It is so important for the future members of our profession to learn how to see both sides of a critical, weird, challenging issue. It's important to learn how to present your case and how to debate with grace. The dental profession is facing all kinds of interesting dilemmas that honestly we just couldn't conceive of even 5 years ago. And so we need real sharp dentists like yourselves to be able to lead us through that. Now, these critical thinking skills are not just important for your leadership in the profession, it's also important for you as a leader in private practice. I just got to the office. I'm ready to start my day in practice. And I'll tell you, almost every day I'm in the office, there's a challenge to my critical thinking skills. And not just from a treatment planning standpoint, patients and insurance companies and family members of patients can present some real interesting ethical and legal dilemmas. And so those skills that you're developing right now, right this morning, are really going to help you see your way through them. I mean, I'll give you an example. Patients that come in and say, gee, I need you to save this tooth no matter what. Put a fourth post in there somehow. Money's no object. Do whatever you can. And you think, this person's asking me to practice beneath the standard of care. This is a hopeless tooth. I can't do it, right? You want to take good care of the patient. You want to do what they're asking you to do, but it goes against your better judgment. You know, there's all kinds of interesting situations that can happen like this. Well, beyond just your critical thinking skills, you also have support. You've got your local dental society, your local study clubs, and you've got experts with your malpractice carrier. You know, that's why I became an EDIC insured years ago, is I saw that they offer service that is second to none. When you form your team as you graduate from dental school, your attorney, your accountant, your supplier, you know, your dental material supplier, all these folks are going to help you as an associate and ultimately as a practice owner. Some of these relationships can be transactional. You know, you pay for something, you get the thing, and that's it. But your malpractice carrier should not be a transactional relationship. You shouldn't just talk to them once a year when you re-up your insurance. Your malpractice carrier should be educating you along the way and offering outstanding support, outstanding service when you need it most. So I joined EDIC. They have great continuing education for you that'll help you keep you and your patients safe. And also, if you ever do get into a sticky situation, you can pick up the phone, talk to a human being who's an expert, and get answers when you need it most. Remember, you're never alone when you're in private practice. We have each other and we have experts at your fingertips. So as you move into private practice, I hope you consider EDIC as your malpractice carrier. It's just the support that we need, and I've made use of it a few times myself when I've had some interesting situations with patients that have come up. So I'm so glad you're spending your mornings here watching these debates. This is just wonderful. I'm so glad you're taking the time to do it. Develop those critical thinking skills, and I wish you guys the best in the years to come.
And welcome to tonight's Yankee Dental Debate. This is our preliminary round number 3, and we're going to be debating teledentistry tonight. And so first, I just want to thank everyone for being here tonight, and thank you again to the Mass Dental Society for organizing this event. My name is Rachel Harris, and I'm the Advocacy Chair, and I'm joined by my other moderator tonight.
Hello, everyone. I'm Rah-Taja Doggett, and I'm Vice Chair for Advocacy. So we will have Harvard versus UConn for tonight. So Harvard will be the affirmative team and UConn will be the opposing team.
Okay, I'll quickly read the prompt for tonight's debate. So, teledentistry includes the remote facilitating of dental care, guidance, education, or treatment via the use of technology rather than direct or in-person contact with a patient. Teledentistry can be delivered through synchronous or asynchronous modalities. Synchronous live video is where the live two-way interaction between a person, like the patient, caregiver, or provider, and the provider is happening using audiovisual telecommunications. Asynchronous, also called store and forward teledentistry, is the transmission of recorded health information, for example, radiographs, photographs, video, digital impression, or others, through a secure electronic communication system to a practitioner who uses the information to evaluate a patient's condition or render a service outside of a real time or live interaction. And so, as Rah-Taja already said, Harvard, you'll be the affirmative team, so you will debate in favor of teledentistry and increasing its use. And then opposing team, UConn, you'll debate against teledentistry and increasing its use. So we will start with the affirmative team. You have 3 minutes to make your opening statement.
You can begin.
Thank you to UConn and all of the judges for being here with us tonight. In our brief time, we shall argue in favor of the current uses and expansion of teledentistry due to its ability to increase access to care, effectively triage patients, and promote interprofessional collaboration. First, teledentistry increases access to care. In rural areas, teledentistry bypasses the challenge of transportation and its associated costs so long as the patient and the providers have access to adequate video calling devices. Beyond rural areas alone, though, a 2020 study from Laval University demonstrated that teledentistry can serve a large swath of people who may be uncomfortable leaving their homes for regular checkup appointments, such as the immunocompromised, disabled, elderly, and those with mental health problems such as anxiety. The virtual visits allow the caregiver to see people in their home environments that provide a more holistic view of the patient's lives.
Second, teledentistry is an efficient way to screen and triage patients. During the COVID-19 pandemic and potentially future outbreaks, safety guidelines have limited patients coming into dental offices. In response, one private practice published an observational study on their practice in 2020. They performed teledental limited evaluations and triages and found that it helped to determine if patient concerns were non-urgent or emergent with great success. Also, hygiene assessments by hygienists allow the dentist to focus on diagnostic and restorative care. Australian studies in 2017 and 18 demonstrated that the caries detection and general oral health screenings for school-age children and those in assisted living were effective ways of increasing their access to care and dramatically decrease costs. For example, the average cost for teledentistry screening for a child was only $19, while the traditional screening was a minimum of $41 per child, resulting in a potential countrywide savings of $85 million per year. Positive results have been seen in screening for orthodontics, prosthodontics, and oral lesion identifications to date as well. And finally, teledentistry is already bridging the gap in interprofessional collaboration and establishes better patient-centered care. For example, teleradiology may be used in cases of maxillofacial trauma in peripheral centers connecting with the main trauma center. Specialist referrals are currently sent asynchronously to specialists with radiographs, patient information, etc. for consultation. Every time a dental professional does this, or something as simple as emailing a faculty member to discuss a case, they are using teledentistry. Its common use in this way is incredibly effective and clearly demonstrates the ADA's principle of beneficence. And indeed, recent studies have shown that teledental referrals and consultations have resulted in better patient outcomes, shorter wait times, and more satisfied patients. Most recently, supervised procedures, something called telesurgery, are of great promise for specialists to assist other licensed professionals in remote areas virtually when access to specialized care is not possible.
The future for teledentistry is certainly bright, and we look forward to the advances that will emerge as a result of the current pandemic and beyond.
All right, thank you, affirmative team. Opposing team, you have 3 minutes to make your opening statement.
Restorative and hands-on dental procedures comprise a majority of everyday dental care. Since the beginning of the COVID-19 pandemic, patients have had no choice but to stay at home while their teeth decay further and complications arise. As such, it is imperative that we find a way to get our patients into the dental office so that they can receive the care that they need and deserve. While the intent of teledentistry may be to prevent oral disease and promote oral health awareness, teledentistry does not offer a solution for restorative and hands-on dental care. The use of teledentistry can become dangerous in cases with a fast rate of disease progression, as the care is only limited to virtual means. The ultimate outcome for such a patient is increased treatment costs and pain, only to receive care that occurs much less efficiently. Teledentistry poses a high potential for misdiagnosis as well as missed diagnosis. Oral exams involve rigorous documentation of findings by tactile and visual inspection of soft and hard tissues. This diagnostic accuracy is greatly reduced with teledentistry, as the diagnosis is restricted to visual means only. This leads to an increased rate of error, causing our patients increased health complications, higher treatment fees, and a distrust in their practitioners. The dangers of teledentistry are particularly exemplified by its lack of insurance reimbursement. Many insurance companies, such as Care First, Blue Cross, and Blue Shield, explicitly state no reimbursement for teledentistry. If reimbursement isn't even offered, what's to say that this is a legitimate treatment option? Moreover, the trends seen in already existing teledentistry entities, such as Smile Direct Club, have shown that their DIY dentistry model of treatment stifles the quality of care. In 2019, Texas Bill SB 792 was written, restricting dental professionals from providing continued care via teledentistry for more than 12 months without at least one in-person visit. The need for a bill like this demonstrates the problematic nature of teledentistry and how easily it compromises high-quality care. Several class action lawsuits have been filed against Smile Direct Club and companies alike, further demonstrating the harm of teledentistry. Oral health education is already embedded into in-person dental visits. Therefore, using teledentistry for oral education is counterproductive. Resources would be better spent towards dental innovations, such as the Pivodyne iodine or oral antiseptic rinse, which was engineered by the UConn dental faculty to minimize the transmission rate of SARS-CoV-2 in the office. We are in a global pandemic, and money spent on PPE and other disinfection measures would have a greater impact on the overall health of our patients. Thank you.
Thank you, opposing team. Opposing team, I'll have you speak again. You have 1 minute to cross-examine.
Okay, good evening. Tonight my colleagues have mentioned several of points. First point they have mentioned is that teledentistry increases the access to care. Well, I would like to point out that with increased access to care, the quality of care is significantly reduced. This is shown through many existing teledentistry on-demand models and services which connect you to a random dentist where your continuity of care is significantly suffered. They've also raised an issue of where they would say that dentists have a balanced income, and then in order to increase the access to care, well, I would like to say that they would dentists would have an incentive to balance their income and see more patients where their quality of care is again reduced. They've also said that teledentistry is best for preventative care, but I would like to say that it's the dentist's job to care for their patients, and part of that is involves spending more money on teledentistry, which is just a waste of time. Yeah.
All right, thank you. Affirmative team, you have 1 minute to cross-examine.
You have mentioned that coming into an office when someone is in pain is better, but I would like to argue that there are some patients that may not need to come into office to visit at all. There are many different cases of many different forms of pain. There's oral facial pain the facial pain that might not even be related to dental issues, and there might be psychological factors that come into play. Having a teledentistry visit first might be able to allow the dentist to further evaluate before to see if there's even necessity for the in-person visit. Also, you mentioned that that there's more diagnoses. I was wondering what the evidence is for that.
And the oral exam is necessary for oral exam necessitating tactile. We found evidence of the contrary, actually, that in Brazil, 88% of oral lesions could be diagnosed without in-person visits whatsoever.
All right, thank you, affirmative team. I'll have you speak again. You have 3 minutes for your rebuttal and closing.
Okay, so first off, we noticed that you mentioned that with an increase in access to care, there's a quality of care that's reduced. Now, we'd like to note that usually an increased access to care, what we're referring to is the fact that more people in rural communities and those that are currently disenfranchised by the healthcare system are able to access care more efficiently. We're not trying to refer to Smile Direct Club and those clubs that seemingly are targeting consumers to make their smile perfect or necessary measures like that for them. Those are harming consumers and actually harming those marginalized groups even more. So we've been seeing these things show up more and more throughout time, and want to make a note that teledentistry is referring to our general dentists and specialists who are able to treat these people appropriately through synchronous and asynchronous methods. You also mentioned that dentists have the incentive to see more patients when the amount of time is spent is reduced, and we do agree with this. So we believe that there has to be legislature and more research that needs to be done on teledentistry so we can make it more efficient so professionals are able to get their proper reimbursement correctly. In the same note, we need to make sure that insurance companies are reimbursing this properly, or the dentists are in fact spending more time. We need to act with justice and with veracity and truth with our patients to make sure that dentists are getting refunded properly and to make sure that patients are indeed receiving the care that they deserve. Also, the dentist's job is to spend money on their patients, and they may end up spending more on teledentistry, you're correct. But if this is helping more patients gain access to care, isn't that worth it? Shouldn't we be trying to help our patients in the most ways possible? And if we're able to see them in their home environments, this is probably the best way to move forward with that.
Furthermore, you mentioned that it reduces reduce health outcome. This might not be the case in the case of a pandemic, because if someone comes into the dental office and end up catching COVID, then you're seeing much worse outcome and a lot more cost. We hope that our argument has made it evidence just how much teledentistry is being relied on now and the great possibility that exists for its future. It has the potential to increase access to care for those with transportation problems, at-risk populations, and those with dental anxieties. Especially during the pandemic, teledentistry is used for triaging patients from afar and see how urgent their concerns may be. During the more normal times, though, it still has great health screening at risk for children and populations in nursing homes. Finally, and perhaps most importantly, is current use into the day-to-day, like emailing back and forth about a difficult case in the clinic, have greatly improved interprofessional collaboration, as well as our ability to treat patients better, more beneficent ways. The ultimate goal is not to replace in-person dentistry entirely, but to integrate teledentistry.
All right, thank you, affirmative team. Opposing team, you have 3 minutes for your rebuttal and closing.
Good evening. So just to address some of the points that my colleagues just made, so a lot of rural areas actually don't have access to broadband Wi-Fi, which poses a huge issue with teledentistry because these people can't get access, and they would probably have better access to dental care via public transportation. Also, emailing back and forth with your dentist is not considered teledentistry. That's just communication, and that does not comply with HIPAA or confidentiality. Over the course of this debate, we've discussed teledentistry in all of its forms. We've discussed its assets and its shortcomings. Although we acknowledge many of the considerations that our colleagues have raised, teledentistry represents a danger to oral health care, and its use should not be taught nor advocated. Since the start of the pandemic, the oral health of patients has been severely affected with countless cases, which now require immediate in-person treatment. It's too late for preventative measures. The only practical solution is immediate diagnosis and provision of quality treatment. While my colleagues have argued that teledentistry is a tool that dentists should use to completely fulfill their healthcare obligations, I would like to respectfully remind them of the dangers of teledentistry. In a situation where the intended use of teledentistry is to make simple diagnoses, prescribe medications, or counsel patients, the outcome can be catastrophic. Picture the following scenario. Miss Brown is a 76-year-old woman who relies on her walker to get around. It's been 14 months since she has gone to see her dentist. Although she is overdue for a cleaning, she has luckily had no glaring issues over the past 14 months. That is, until 4 days ago when she notices a small raised area on her palate. Miss Brown lives alone and is worried that she might have oral cancer. She schedules an appointment with her dentist virtually, using a camera to show her dentist her palate. Her dentist diagnoses her with torus palatinus, a completely harmless bony growth on the roof of the mouth. The dentist reassures Miss Brown that this is not oral cancer, giving her a peace of mind. 12 weeks later, Miss Brown begins to feel pain on her palate. She notices that the growth has become bigger and in a panic rushes to the emergency room. She finds out that she has stage 3 oral cancer and that she will need chemotherapy and possibly surgery. The ER physician tells her that if she had come when she had first noticed the growth, it could have been removed and she would have completely cleared the cancer. We can all see the danger of this situation. The intention of helping Miss Brown was there. However, the limitations of it tricked Miss Brown into thinking she was healthy when she was in fact sick. The use of this tool for modern dentistry would be unwise and harmful to our patients, as seen in the example with Miss Brown. Therefore, my partner and I cannot, in good faith, support the increased use of teledentistry. Thank you.
All right, thank you so much to both teams. You both made extremely convincing arguments. As a reminder to our judges who are watching this debate, these sides of the argument were assigned and do not actually reflect the students' opinions. Rather, they were just assigned right at the beginning of the debate. And once again, thank you so much to Massachusetts Dental Society, Janine, all of our judges, everyone who has helped make this debate possible. And this is Yankee's 12th year now and our first virtual year. So thank you so much to all of you debaters and everyone for making it a success. I hope that you all have a good night.